ज्ञान यात्रा साप्ताहिक वेबिनार श्रृंखला के 238वें एपिसोड में आज हमारे साथ जुड़े हैं। मैं डॉक्टर रिया गोयल, प्रोजेक्ट मैनेजर, राष्ट्रीय आयुर्वेद विद्यापीठ की ओर से आज के सत्र के लिए आप सभी का स्वागत करती हूँ। आज हमारे इस ऑनलाइन वेबिनार के मुख्य वक्ता के रूप में हमारे बीच उपस्थित है डॉक्टर के निशांत पाई सर, सीनियर कंसल्टेंट एंड हॉस्पिटल एडमिनिस्ट्रेटर, S.D.M आयुर्वेदा हॉस्पिटल कुतपड़ी उडुपी। शुरुआत में मैं आपकी हार्दिक कृतज्ञता व्यक्त करना चाहती हूँ, उन गुरुओं का स्वागत करना चाहती हूँ जो इस श्रृंखला को जारी रखने के लिए हमारे मार्गदर्शन, प्रेरणा और प्रोत्साहन करने के लिए उपस्थित रहते हैं। माननीय वैद्य देवेंद्र तिगुना जी, जीबी राष्ट्रीय आयुर्वेद विद्यापीठ, सम्मान्य वैद्य राजेश कटोचा जी, सचिव आयुष मंत्रालय भारत सरकार, माननीय निर्देशिका वंदना सिरोहा मैडम, राष्ट्रीय आयुर्वेद विद्यापीठ। आइए भगवान धन्वंतरी का आशीर्वाद लेकर सत्र की शुरुआत करें। नमामि धन्वन्तरिमादिदेवं सुरासुरे वन्दितपादपद्मं लोके जरारुक् भयमृत्युनाशं धातारमीशं विविधौषधीनाम्। आगे मैं आज के विशेषज्ञ वैद्य के निशांत पाई सर का परिचय करना चाहूंगी, जो रसायन चिकित्सा इन मार्गावरण पर प्रकाश डालने जा रहे हैं। आज के इस शैक्षणिक कार्यक्रम में हमारे विशिष्ट अतिथि एवं वक्ता के निशांत पाई सर का हार्दिक स्वागत करने में मुझे अत्यंत प्रसन्नता महसूस हो रही है। निशांत पाई सर एक अनुभवी आयुर्वेदा चिकित्सक एवं शिक्षाविद हैं, जो वर्तमान में S.D.M आयुर्वेदा हॉस्पिटल उडुपी में वरिष्ठ परामर्शदाता एवं प्रशासक के रूप में कार्यरत हैं। इन्होंने राजीव गांधी स्वास्थ्य विज्ञान विश्वविद्यालय बैंगलोर से BMS और MD काय चिकित्सा की उपाधि प्राप्त की है तथा वर्तमान में कांचीपुरम स्थित चंद्रशेखर सरस्वती विश्व महाविद्यालय से PhD कर रहे हैं। MD के उपरांत एक दशक से अधिक के शैक्षणिक एवं चिकित्सीय अनुभव के साथ डॉक्टर निशांत ने KMC मैंगलोर और S.D.M कॉलेज ऑफ आयुर्वेदा उडुपी में सहायक प्राध्यापक के रूप में सेवाएं दी हैं। साथ ही में जयदेव मेमोरियल राष्ट्रोत्थान अस्पताल एवं अनुसंधान केंद्र बैंगलोर में मुख्य चिकित्सक अधिकारी के रूप में भी कार्यरत हैं। डॉक्टर निशांत पाई ने काय चिकित्सा, रसायन चिकित्सा, वात व्याधि एवं दीर्घकालिक रोगों के क्षेत्र में उल्लेखनीय शोध कार्य किया है, जिसके अनेक शोध पत्र राष्ट्रीय एवं अंतर्राष्ट्रीय पत्रिकाओं में प्रकाशित हुए हैं। वे विभिन्न सेमिनारों, CME और कार्यशालाओं में एक प्रतिष्ठित वक्ता के और संस्थान व्यक्ति के रूप में सक्रिय रहे हैं। हम सौभाग्यशाली हैं कि आज हमारे बीच में डॉक्टर निशांत पाई के विचारों और एवं अनुभवों का लाभान्वित होने का अवसर प्राप्त हो रहा है। हमें पूर्ण विश्वास है कि उनका इस सत्र को अत्यंत ज्ञानवर्धक बनाएगा। इन्हीं शब्दों के साथ में एक बार पुनः डॉक्टर निशांत पाई से निवेदन करती हूँ कि आज के सत्र की शुरुआत करें। आप सभी से रिक्वेस्ट है कि अपना कैमरा एंड माइक ऑफ कर सकते हैं, दैट वी कैन स्टार्ट विद द सेशन। सर प्लीज।
Thank you, Dr. Riya Goyal, the project manager of this particular webinar series. First of all, I would like to thank Dr. Vaidya Devendra Triguna ji, President of RAV, Dr. Vandana Shiroy, Rajesh Kotecha ji sir, and all the members of RAV for giving me an opportunity to present on this particular esteemed platform. Thank you, Riya. So we'll start with the presentation. So today I will be presenting on Margavarana and its management, specifically Rasayana. So I would like to share the screen. So this is visible.
Yes.
Okay. So Margavarana. So first we have to identify what is Marga and what is Avarana. Then we can identify how it can be managed. So first, let me put some light on the outer aspect of the Marga. So here, what is Marga? So if at all we want to identify Marga, then comes the Avarana, then comes the pathology.
Sir, sorry to disturb you, but आपका PPT थोड़ा visible नहीं है सर। आप इसको एक बार चेक कर लीजिए।
Okay.
विजिबल तो है बट क्लियर नहीं है सर, एक बार थोड़ा क्लियर हो जाएगा तो अच्छा रहेगा।
क्लियर नहीं है, ओके।
हाँ।
अभी इज इट विजिबल?
सर अभी थोड़ा क्लियर नहीं है सर। क्लियर नहीं है।
पहले से थोड़ा बेटर है, लेकिन ये आउट ऑफ फोकस लग रहा है।
अच्छा, ओके, एक मिनट, already on the, so let me switch on to other. Is it visible? Am I audible?
Yes, sir.
Okay. So let's move on with the avarana. As I was explaining, marga as well as avarana are the two entities that need to be identified. So first, the marga refers to the rakta marga. So why it is rakta marga? Sarva eva chasya rogaha balavanto bhavanti. So as it involves the srotas, the marga, so these are the diseases because of the avarana is considered to be balavan rogaha. Atasya utpatti hetum pariharet. That is why it need to be addressed based on its utpatti hetu, the cause of which has to be identified, then it has to be treated. That is avrita margatvat, srotasam. So avarana of the srotas, here specifically we have taken a rakta marga. So rakta marga avarana, that is the srotas which causes the different types of illness. And what is the utpatti hetu? The utpatti hetu being the santarpana nidana. And what does this santarpana nidana does? It causes kapha,
Excuse
medha.
me. Hello. Excuse
Hello.
me, your slides are totally blurred, not visible.
Not visible.
It's blurred.
Is it visible now?
The larger letters are visible, but smaller letters are not still clear.
Okay, sir.
Sir, can you share the PPT that from here we can
Okay,
share
I'll
it?
do one thing. I'll share the PPT. Yes, okay. So if it is okay with that. So can I share it on? I have to share it on WhatsApp.
Yes, sir, you can share by WhatsApp. Sir, within 5 minutes we'll start, sir. When we receive the PPT, we'll start. Okay.
Hello. Okay. Sorry for the inconvenience. I had some technical difficulties in the PPT, which is not visible. That may be due to our network. So we'll start with the Margavaran.
Sir, it's bit clear, sir. You can start with this.
Sir, it is visible.
घंटा लाओ फिर आपकी जाने लग जाती। शुरू ही नहीं किया सर इन्होंने, कोई पीपीटी वगैरह कुछ भी नहीं। अब कर रहे हैं, अब कर रहे हैं।
So I think there were some technical glitches. So sorry for the inconvenience from my side. I think I am audible now. Dr. Ria, please confirm.
Hi, yes, sir. You are audible, sir. You can start with
And
the session.
this time, is it visible?
PPT is still blurred, sir, but we can start.
This is again the problem with the network, I think. So I can
Yes,
share
sir.
the pictures from here. So if you can display from there.
Okay, sir.
So if Ria can share that, I can present from here.
Excuse me, Riya ma'am. Actually, I am unable to hear anything. The voice is inaudible.
Ma'am, we are starting. Actually, we are sharing the PPT.
Okay.
Wait 2
So
minutes.
I'm
We are starting. It's
okay.
not started yet.
Okay. I'm supposed to think that it is already started and I am
No, ma'am.
unable to. Okay.
Ma'am.
Thank you.
Wait for 2 minutes. Shortly, we'll start
Yeah,
the session.
it's quite okay. Quite okay, ma'am.
Okay. Sir, you can start. Sir, you can start the session, sir. Nishanth, sir, I am audible.
Yes. Loud and clear.
Nishanth, sir, I am audible.
Hello.
Sir, you can
Hello.
start the session, sir. We have shared the PPT. You can start.
Okay. So as we were speaking about the avarana, so we need to identify that this is a Rakta Margavarana. And in Rakta Margavarana, specifically, Sroto Avarodha that occurs. Now we have to identify what is the Srotas. Now Srotas is always a Rakta Marga. Why we have to identify this as a Rakta Marga? So that is because Charaka has explained in Sroto Viman that it is nothing but the Dhamanis. If you open Charaka Samhita, Vimanasthana, Sroto Viman, in that it is clearly says that this particular Srotas that has been mentioned is nothing but Rakta Marga only, that is Dhamani only. So this particular Dhamani, due to the Santarpana Nidana, will have Kapha and Medo Dushti. So Kapha and Medo Dushti, this particular Kapha and Medo Dushti cause Dhamani Pratichaya. This particular Dhamani Pratichaya may occur in anywhere in the Rakta Mahasrotas or Rakta Marga or Rasarakta Marga together. Then this will cause the disease of that particular area. What are the treatment that has to be given? That is Rasayana, Shodhana, Shamana. These are the available mode of treatment. Now we'll see how this particular avarana occurs. The next slide. See, Viruddha Ahara being one of the Nidhana for this particular Margavarana. So, Viruddha Ahara in the sense, so if you open Charaka Sutra 48th chapter or 26th chapter, there it has been mentioned that Na Matsyan Payasam Abhyavaret, Saha Abhyavaret, Ubayam Hetun Mudraha, Mudra Vipaka, Mahabhishanda, Shonita, Shitoshna Viruddha Viryat, Viruddha Viryavat, Shonita Pradushanat, Mahabhishandatvat, Margoparodacha. So, that is Viruddha Virya, or there are different types of Viruddhas, Shitoshna Viruddha, Virya Viruddha. Such kind of Viruddha is called as Mahabhishandha. And this particular Abhishandi quality is imparted into Rasarakta Mahasrotas. And this Mahabhishanda quality is due to Medas and Kapha, which is caused Marga Uparodha. So Uparodha, Avarodha are the same. Marga Uparodha. And later on, it can completely obliterate the circulation there. So Abhishanna refers to Meda Kapha Abhivyapta Shiraha. Meda Kapha Abhivyapta Shiraha. That is Margavarodha. So one is Viruddhahara causing Margavarana. Abhishandata of this particular Viruddhahara will enter into the Srotas, and this particular Marga will have Margoparodha, and this particular Margoparodha is because of Meda Kapha Abhivyapta Shiraha. Next. So what is Viruddhahara causing? How it is causing Dhamani Pratichaya? So Meda Kapha Abhivyapta Shiraha will cause Dhamani Pratichaya. How it causes Dhamani Pratichaya? न पौष्करम रोहिणिकम शाकाम कपोताम वा सर्षप तैल भ्रष्टान मधुपयोभ्याः सह अभ्यवरे तन्मूलम हि शोणिताभिषन्दन धमनि प्रतीच्य. So this will cause different types of disease such as apasmara, shankaka, galaganda, rohini nam anyatamam prapnoti atavaha maranamiti. See, the intensity of this particular disease may start from simple shankaka, the headache, till that of the maranam. So that is the importance of this particular disease, this particular pathology. So this particular pathology has to be identified at the earliest, then it has to be treated as such. So Viruddhahara, as far as Viruddhahara is concerned, we have identified that Viruddha Virya or Viruddha Rasa, so such kind of ahara should not be consumed, and if it is consumed, will cause Shonita Abhishandana. Abhishandana we have seen in the earlier sloka as Kapameda Abhivyapta Meda Kapameda Abhivyapta Shiraha, which will cause Dhamani Pravichaya, and Dhamani Pravichaya cause the different disease starting from Apasmara to Shankaka, Galaganda, Rohini, and other types of diseases. Next. So Santarpanotta Vyadi. What is Santarpanotta Vyadi? That is over nutritious food, lack of exercise. So is nothing but sedentary lifestyle. This is called as sedentary lifestyle. So why we are identifying this? One is the Viruddhahara. Second one is the Santarpanotta Nidhanas. Santarpanotta Nidhanas are nothing but तत्र श्लेष्म आहार सेविनो अध्यशन शीलस्य अव्यवायिनो दिवस्वप्न रतस्य च आम एव अन्नरसो मधुरतर शरीरम अनुक्रम अतिस्नेहम मेधो जनयति तद अतिस्थौल्यम आपादयति सर्व एव च अस्य रोगा बलवन्तो भवन्ति आवृतमार्गत्वा स्रोतसाम अतः तस्य उत्पत्ति हेतुं परिहरेत्. So this is identified as श्लेष्मल आहार सेविनो. So that which acts as a morbid, which causes a morbid shleshma, and adyashana shilasya, so who eats oftenly, vyayamino, so he doesn't do the vyayama, and divaswapna ratasya, so who sleeps on the morning hours also. Cha ama eva annaraso. So why this is annarasa is important, as we have seen that in the earlier line, that dhamani is nothing but the srotas. So the way in which the srotas is doshas are nourished, similarly the doshas will get vitiated. This is how it happens. So that is why it is very important to identify that accumulation of medhas and sneha in this type of nidanas. So madhuratarasya shariram anukramannati tad atistaulyam apadayati sarva eva chasya roga bhalavantoho. So sneha and medas has been created. This sneha and medas will cause a obliteration to that of the srotas, and that particular obliteration will cause different types of diseases. How it will cause different types of diseases, that we'll see in the next slide. Yes. So next. So Santarpana Nimittaja Vyadis. So which are Santarpana Nimittaja Vyadis? So Santarpana Ahara as well as Viruddhahara will cause Viruddhahara will cause Margavarana. Santarpanotta Ahara will also cause Margavarana. So how Santarpanotta Santarpana Nidana Ahara Vihara will cause Santarpana Nimittaja Vyadi. So Santarpana Ahara Santarpati yah snigdhair madurair guru pichilaihi navannair navamadhyaha mamsaischa anupavarjaihi gaurasa gaudika cha. So these are the different types of Santarpana Ahara that has been mentioned, which are, as we have explained earlier, that these are going to cause kapha and medha morbidity. So because of which there will be rogas tasyobajayante santarpana nimittajaha. So there are some of the explanation, the diseases that have been mentioned. One of them is prameha pidaka, kotha, kandu, pandu, amaijvaraha, kustan, amapradoshaya, mutrakrachadashaka, tantraklebhyati stholyam, alasyam, gurugatrata, indriya srotasa lepaha. So indriya and srotaso lepaha, badder moha pramilakaha. So Srotasa Lepa is the one that happens. Srotasa Lepa in the sense, so as we have seen earlier, that is Dhamani Pratichaya, Dhamani Vistara Bhava. Dhamani Pratichaya, Dhamani Vistara Bhava. So that has been mentioned. Next. So sedentary. So how we are correlating this? That is sedentary lifestyle is santarpana nidana, increased fat metabolism, that is kapha medo vruddhi, dyslipidemia, or patient may have hyperlipidemia or dyslipidemia, that is correlated with that of the shonita abhishandana, that is abhishanda medakapha vyapta shiraha, plaque formation upalepa, rasarakta marga upalepa, atherosclerosis, that is dhamani pratichaya, and then comes the vascular obstructive diseases, Margavarana. So this is how the chronology goes. This is how the samprapti can be identified in Margavarana. So very simple. That is santarpana nidana cause kaphameda vruddhi, shonita bishandana, rasarakta marga upalepa, dhamani pratichaya, and margavaroda. And margavaroda, depending upon the area, the disease will occur. Next. Yes. Yes. Here again we have dhamani pratichaya, श्लेष्म विकारांश विंशति मतः ऊर्ध्व व्याख्यासम तद्यता धमनी प्रत्यय. So according to श्लेष्म नानात्मज व्याधि धमनी प्रत्यय is one among them. So श्लेष्म is nothing but श्लेष्म मेदो अभिव्याप्त शिरः, in which different types of disease can occur. Different types of disease can occur, and that particular disease may have that particular pathology may have diseases. So this particular have plaque formation. Dhamani pratichayah dhamani upalepa. Upalepa iva kenachin pishtena kante hridaya cha upalepa. How it has explained, like a pishta that is adhering to the gala or the kantha or the hridaya. Similarly, dhamani pratichaya dhamanishu upalepa. That is just like a upalepa of tunica intima of the arteries. Sharik vakshmanasu tasya upalepasya atishayo atipuranam. So that will fill the lumen of that particular artery, and that lumen will cause an obstruction to the blood flow, and that blood flow will hamper the nutrition to the other part of the circulation, and that will cause the disease. That is, Shleshma Vikara will cause the plaque formation and obstruction to the blood flow. This is one thing. Yes. Yes. So presentation varies according to the area. As I said, the srotas is all over the body, and this particular srotas may go on from any one particular area to any area. So this particular diseases, that is sthanani anurupascha lingay sheshan vinirtishes. Depending upon the area where the obstruction is, depending upon that the depending upon the area where the avarana is, depending upon that the presentation varies. And this particular presentation may.
Excuse me, no PPT.
Sir, we are sharing, sir. We are sharing.
So that is Kleshma Vikaramsha Vimshati Meva Urdu. As I said, that is the Dhamani Upalepa Atipurnam, and this particular Atipurnam will cause the obstruction of the Srotas. So then then comes the area. Depending upon the area, this pathology can be done or considered as anything. That is starting with that of the plaque formation to that of obstruction of the blood flow to that of the pathology. Now pathology is obstruction. Once there is an obstruction, this can obstruct any part of the body. It may obstruct in the Shiras Pradesha, it may obstruct in the legs, it may obstruct in the trunk, it may obstruct in the eyes, or it may obstruct anywhere. So depending upon the obstruction, the disease varies. So that is why it is very important to identify the pathology first, because the disease may be different, but the pathology remains the same. Now, next. See, Margavarana in Vatvyadi. So, as I said, the Avarana may be one, but the disease may be different. So, if the same pathology occurs in the Shiras, it may be Vatvyadi. The same obstruction may occur in the legs, it may be Vatrakta. The same obstruction occurs in the Mutravasrotas, it may be Mutraukasada. The same obstruction may occur in the Hridaya, it may call Hridroga, Hridshula. So what happens? Kaphamedho niruddha margatvat alpa vyavayo bhavati avrata margatvat evaha shesha dhatavo na apyanyate atyartham atho alpa pramano bhavati. So that is, once there is an obstruction, the other dhatus on the other side will not get the required nutrition. Because of that, the disease will occur. Sarva eva chasya roga balavanto bhavati avrata margatva srutasas. That is why it is considered to be very serious illness. And Medakrita Margavarana Nimittaha Vata Kopa Vikara Ityartha. So here why it occurs? Because it will be obstructing the Vata Marga, that is a Medakrita Margavarana. So this Medakrita Margavarana has to be identified as the prime pathology. If at all, let I give you an example of cerebrovascular accident. So cerebrovascular accident may have different types of pathology. One of the pathology is Margavarana. Similarly, there may be different types. If at all cerebrovascular accident is considered as one disease, no, it cannot be considered as one disease, because in Ayurveda, all the Vata Vyadhi is considered as Pakshagata. So all the cerebrovascular accident are considered under Pakshagata if the one side is involved. But Pakshagata again has to be subcategorized depending upon its pathology. All the Vata Vyadhi that has been mentioned in Ayurveda has been by Charaka has been divided as Swakopana, Margavarana, Marmabhigatajanya. So these are the three identified. So that is whether it is Margavarana Pakshagata, or it is Swakopanajanya Pakshagata, or it is Marmabhigatajanya Pakshagata. In some areas, if at all I take cerebrovascular accident with the hemiplegia, half of the body is involved. So patient may have ischemic attack or infarct, or it may be hemorrhagic attack, or it may be malignancy that has presented. So these has to be categorized into different pathology, because treatment of the cerebrovascular accident may not remain the same. That is why, so disease will be different depending upon the pathology, though the presentation is same. If at all Vata Vyadhi, the Pakshagata is present, so if the person is suffering from Margavarana, so Margavarana Chikitsa will be done. If the Pakshagata is having hemorrhage as the identified as the pathology, then it is Shonita Duštijanya, Shiro Marmabhigatajanya Pakshagata. The treatment is entirely different. So this is how the pathology is identified. Next. Yes. So different location, different diseases. So that is what we were explaining here. So in the areas, that is Sthanani Anurupena Lingai Sheshan Vinirdishet. Depending upon the lakshanas, the disease depending upon the areas, the disease lakshana will change. So that is तथा तेभ्यः स्रोतो अभ्यो अन्य दोषपूर्णेभ्यो आवरणं प्राप्य बलि वायुरेव कुप्यति. When there is an avarana in Vatavyadi, so Vayureva Kupyati, because it is obstructing the marga. What marga? Rasarakta marga. Rasarakta marga is the liquid dhatu or the jaliya dhatu which is moving from one part to the other part. So that movement is precipitated by Vyane Hridisthitehe. So that avarana is occurred to that particular Rakta marga, because of which Vayureva Kupyati. अतः कुपितो पित्तकफो समुद्धूय ताभ्याम आवृतमार्गो अपि तत्र तत्र प्रदेशान् गतान् करोति. So as we know that sarva rogaः tridoshajah, though it is a raktamarga varana, once it causes damage to that particular area, the sthanika dosha of that particular area will also involve in this particular pathology. Say that in vatarakta. So vatarakta, the obstruction to the raktamarga to the limb may occur, and this particular raktamarga obstruction will cause, so maybe cause the infection and abscess and puya. So first there may be paka where pitta will be present, then there may be puya where kapha is also present. So it becomes tridoshaja vyadi. By default, all the diseases are tridoshaja. Here the major dosha that is being involved is a vata, and the sthanika dosha involved later. Vata pitta kapha dosho sarva sroto anusarena vayureve sukshmatvat vayos tatra api udirana kupitastu samudaya tatra tatra kshipan gadan. So that is wherever the disease is getting sthana samshaya, there the disease occurs. So this is different location, different diseases. Different location, different disease. Karoti avrata margatvad rasadis cha upashoshayet. Why this particular disease is very important? Rasadimscha. Rasadimscha in the sense the nutrition that has to be supplied to that particular part of the body is curbed, because of which the disease will occur. Next. Yes. What are the treatment that need to be aimed? Treatment will be Shodhana, Shamana, Rasayana, Ahara, and Vihara. As we have seen, as this is a very serious illness and a chronic illness, Shodhana has to be the prime line of treatment. Shodhana has to be prime line of treatment. After that, Shamana, Rasayana, Ahara, Vihara can also be tried. So starting Vyayama Shodhana Arista Mutrapanair Virechanai. So Vyayama Shodhana Arista Mutrapanair Virechanai. So as we have seen that this is a Kaphamedas is involved in this particular disease. So Shapana Chikitsa has to be done. The next line says Takra Abhaya Prayogaischa Shapayet Kaphamedasi. That is Vyayama Shodhana Arista Mutrapaner Virechani Takra Bhaya Prayogaischa Kshapayet Kaphamedasi. So first is Vyayama. Most of the time, before occurrence of any disease, Kaphamedo Abhivyapta Sharira has to be treated with Vyayama. Then go for the Shodhana. Then Shamana, that is Arista Mutrapana Virechani. Then Ahara Vihara. So this has to be the line of treatment. Bodha Vriksha Kashayam. There are some of the preparation that has been mentioned. Bodha Vriksha Kashayam Prapiben Maduna Saha Vatarakta Jaityashu Tridosham Api Darunam. So this is specifically mentioned in Daruna. Daruna Tridoshaja Vatarakta. Purana Eva Godoma Sidu Arista Surasabai. So these are the Ahar Viharja Bhava that has been mentioned. So then some of the specific Rasayana has been mentioned which can be utilized in Kaphavedo Abhivapta Sharira. That is Shilajatu Prayogaischa Guggulur Makshikasya. So that is Shilajatu Prayoga and Guggulu Makshika Prayoga. So this Shilajatu is also identified in Charaka Rasayana Dikara. That is Shilajatu Prayoga, Shilajatu Rasayana, Shilajatu Loha Rasayana. And Guggulu is also Kaphamedo Hara. So these both can be utilized as best in treating the Margavarana. Next. Yes. So as we have seen, though the location may be different, but the treatment need to be same. Treatment need to be same in all the conditions. So we have to identify this disease as, it may be Pakshagata, it may be Hrudshula, it may be Vatarakta, or it may be Mutraukasada. Even Mutraukasada is one of the diseases which is considered as disease of the Mutravasrotas, but it is a Margavarana Janya Mutraukasada, and in this particular Shilajatu Prayoga and Gugulu Prayoga has considered to be the best. Next. So Margavarana in various diseases. So as I said, that Hrudrogo, Vidridi, Pliha, Gulma, Atisara evacha bhavanti upadravastesham avratanam upekshanat. So Avarana may not, Margavarana may be simple pathology. So it can occur anywhere in the body, but neglecting this particular Margavarana at the earlier age. As in the earlier shloka we have seen, Vyayama, Virechana, Mutra, Rasayana, these are the different modality of treatment that has been mentioned, but the first being the Vyayama. Why Vyayama? Because in the earlier stage, Margavarana is just Kafamedo Abhivyapta Shariraha. When Kafamedo Abhivyapta Shariraha, when the patient is obese enough or overweight, patient has hyperlipidemia, in such condition, we have to identify it as a pathology, and this pathology need to be rectified with the earlier intervention in the form of Vyayama. And if that fails, then one has to intervene in the form of Virechana, then Shamana, then other modalities of treatment. Bhavanti upadravastesham avratanam upekshana. So upadrava may occur if at all it is neglected. And if it is neglected, what are the things that may happen? Hrudroga, ischemic heart disease. Why ischemic? Because Margavarana. Vidridi, Pliha Gulma Atisara evacha. So Pliha, enlargement due to hyperlipidemia, splenic enlargement as a compensatory mechanism to liver enlargement due to hyperlipidemia. So fatty liver and compensative splenic enlargement. Then Atisara, mesenteric artery insufficiency causing Atisara or ischemic colitis can also be considered here. So these are the variety of diseases depending upon the Margavarana. Next. So what are the things that has to be done? So in the earlier cases, it need to be identified and the patient has to be prescribed with the patient can be prescribed with simple treatments such as Vatanuloman, Rasayan. So simple treatment in the earlier cases, that is अनभिष्यन्दिभिः स्निग्धाः स्रोतसां शुद्धिकारकः कफपित्तविरुद्धः यद्यच्च वातानुलोमनं सर्वस्थानावृते अप्याशु तत्कार्यं मारुते हितं रसायनानां सर्वेषाम् उपयोगाः प्रशस्यते शैलस्य जतुनो अत्यर्थ पयसा गुग्गुलोस्ततः लेहं वा भार्गव प्रोक्तस्य अभ्यसेत् क्षीरभुक्नरः अभयामलकी उक्तम एकादश सिताशनम, that is Utpatti Hetu Pariharet, in the sense Kafamedo Hara has to be done, and that can be done by Abhishanda, reducing the Abhishanda quality, that is Shapayet, and when that is Shapana has to be done, that is by the Vatanulomana, by reducing the Vatanulomana, that is by Virechana you can do that. Kafapitta Viruddhyacha Vatanulomanam Sarvasthanavrate Apyash Tatkuryam. Once the Virechana is done, then you can go for Rasayana. So Rasayanam Sarvesham Upayoga Prashasyate. So this is a Vyadi this is Naimittika Rasayana, that is Vyadihara Rasayana. This Vyadihara Rasayana can be Shilajatu Rasayana, Gugulu Rasayana, Bhargavarokta Rasayana, Abhayamalki Rasayana. Different Rasayanas can be used depending upon the availability and its efficacy. So, most of the time in my practice, I use Shilajatu Loha Rasayana for the Margavarana with the best results. Similarly, Gugulu Rasayana, Bhargavarokta Rasayana, Abhayamalki Rasayana can also be used. So here Bhargav Prokta Rasayana is nothing but Chavana Prashavaleha as mentioned in Vatavyadi. Next. So this Rasayana prescription is one. So there are some of the diseases. One, we have identified all the organic diseases, but we need to identify the Manasika Vyadi, even the Unmade Vataje Purve. So in the next shloka it says that Kuryat Margata Avrata Margatvat. So there also Avarana is there. So pure psychological illness or psychiatric illness is different and organic illness is different. So these two has to be identified. This is Margavarana not only causing Sharidika Vyadi but also causing Manasika Vyadi has to be identified. As far as Manasika Vyadi, Unmada is one where organic obstruction, that is the circular obstruction, will cause the organic changes of the brain, and because of the organic changes in the brain will cause the Manasika Lakshanas, and this Manasika Lakshana has to be treated accordingly. But the thing is, the underlying pathology being Margavarana has to be treated. Again, same thing. I have only mentioned some of the Rasayanas that can be prescribed effectively in this particular disease, but other Rasayana can also be explored and can be delivered very specifically in the variety of the diseases. Next. So, to sum up, Marga refers to Rasarakta Marga, Avarana refers to Kafamedho Avarana, and Nidana is Santarpana Nidana. This particular Margavarana is Kafaja Nanatmaja Vyadi. So, this is a generalized process of treatment. Generalized process of the pathology is sedentary lifestyle, atherosclerosis, dyslipidemia, atherosclerosis, and different types of diseases such as ISD, myocardial infarction, cerebrovascular accident, or ischemic limb disease. So these are the different diseases that comes under the umbrella of obstructive circulatory disorders. These obstructive circulatory disorder has to be identified as Margavarana, and Margavarana has to be treated accordingly. Specifically, in all the clinical setup, it may not be possible to give Virechana, and Shamana may not be specifically efficient enough to counteract this particular pathology, but with a specific duration and specific dose of this particular Rasayana, this pathology can be reversed to near normal condition. There may be some deviation from the protocols in practicing of the Rasayana because patient may have comorbidities. Say obstructive limb disease may be one thing, Prameha may also be along with that, or Shonita Dushti may also be there. So these has to be identified and treated separately. During the course, the Rasayana may get vary, and the course need to be changed. But if there is no comorbidity, only Margavarana is the pathology, then it can be identified, and with a stipulated duration of treatment with a specific dose of Rasayana, specific dose, I am telling, so dose has to be very specific as it has been written in Charaka Sushrutadi Granthas. So the same dosage has to be given for the efficacious action of the Rasayana to see some result in the patient. So with these words, I would like to conclude my session on Rasayana in Margavarana.
थैंक यू सो मच सर। अगर किसी को भी सेशन को लेके डाउट है तो वो सर से पूछ सकते हैं।
Excuse me.
Yes.
Oh, it's a very good presentation and excellent interpretation of Ayurvedic literature. Even it exactly correlates with the modern view.
Yes, sir.
So only it's a personal view. I would like to know from you.
Yes, sir.
See, the finally it is the circulatory disturbance.
Yes.
So the classically the Ayurveda explains very well as you explained today.
Yes.
So, for example, even this is an established thing, like Lashuna and all these things, they remove the whatever the plaque formation which is present in srotas or vessels,
Yes, sir.
according to modern. So, but at this point of view, we can't say either in Rasayana or in any Shamana Chikitsa.
Mm.
So why it is even according to modern also it is proved that the garlic pills are also available and it is being used and the results are visible.
Yes,
So
sir.
in our Rasayana or the Sroto Shodhana in which do you think this the Lashuna as an ingredient removing the plaques or it is useful in making this Rotas clearance?
Yes,
So
sir. Definitely. So, Lasuna is one among the Rasayana that which has to be given, but the dosage has to be very specific, sir. So, because modern people they use in modern science they use that alanine and allicin as the two ingredients. So, to be very clear, that is alanine and allicin. So, they prescribe in a uh, dosage of one capsule, two capsule, that may be different. So I will not go to that this one. But in Ayurveda, it is specifically said that Rasayana has to be given in a Rasayana dosage form. So as you have explained that, uh, so if I may share the Rasayana, can I share my document here? Can I?
yeah, of course, sir, you are welcome.
Yes, sir. Yes, sir. Yes, sir. So I will explain it. Sir, as we have explained it, Lashuna Rasayana, I will share my document here. Just for the- Sir, here you can see. Is it visible, sir?
Still, you just explain, but
Yes,
it
sir.
may unnecessarily take time to
Yes, yes,
clear
yes.
this technical.
Okay, okay, sir. Okay. Sir, the reference here says that from Ashtangarade Uttarastantra, Kudavo asya param matram tadardam kevalasya to palam pishtasya tanmajna sabaktam prakcha shilayet. So that is Kudava. One Kudava being the full dosage of the Lashuna Rasayana. So this is from the Lashuna Rasayana, sir. Rasayana Adhikara from Ashtangaradaya. Tadardam kevalasya cha palam pishtasya. One pala has to be the pramana. So in Sarvanga Sundari commentary says, Asya Uttama Matram Surasa Sahita Kudavaha. So Surasa may be half and Lashuna may be half. Kevalasya to Rasasyaha Kudava Ardha Param Matra. Only if Lashuna Rasa is given, that is Kudava Ardha Pramana. If it is Pishta, Lashuna Pishta, then it is Pala Pramana. So that is the dosage form. And it cannot be given in all conditions. Why? Because Pitta Kopa Bhayat. So at the end of the Lashana Rasayana, it has been mentioned that Pitta Kopa Bhayat. So that is why Lashana can be given, but in the form of Lashana Rasayana. Sir.
Okay, thank you so much.
Thank you, sir.
अभी किसी को डाउट है तो पूछ सकते हैं सर से।
त्रिपाठी सर का आवाज नहीं सुनाई पड़ रहा है।
If anybody is having doubt, they can ask. Sir, in chat box, one question is there, sir. Can Lashun Rasayana can be administered in a stroke cases associated with Rakta Avarana?
So, yes, Lashuna Rasayana can be administered in Pakshagata, but the thing is, Rakta Avarana has to be the pathology. So, as I said, that all the Vata Vyadhi has different pathologies, and Pakshagata is not an exception here. Pakshagata is also having different types of pathology. Pakshagata may be because of Margavarana, Pakshagata may be because of Marmabhigata, Pakshagata may be because of Swakopana. And in Shiro Trimarmiya Siddhi, you can also see that Shonita Dushti is also one of the pathology of Vata Vyadhi. So we can take that 4 types Pakshagata can occur. One is Margavaran, second one is Shonita Dushti, third one Shiromarma Bigat, and fourth one is Swakopan. So in these, if it is Margavaran, definitely Lashun Rasayana can be administered. And if it is Shonita Dushti, it cannot be administered because Shonita Dushti is Pitta Pradhan Vyadhi. There one can go with the Bala Mula Rasayan. So Bala Mula is one such Rasayana that has been mentioned in Shoshadikara of Charak Samhita.
थैंक यू सर। आयोजन समिति की ओर से मैं डॉक्टर निशांत पाई सर का अपने विचार साझा करने के लिए धन्यवाद व्यक्त करती हूँ। हमारे गुरु देवेंद्र सिंह जी अध्यक्ष सीबी आरएलवी को उनके निरंतर समर्थन मार्गदर्शन और आशीर्वाद के लिए धन्यवाद व्यक्त करती हूँ। हमारी निर्देशिका वंदना सिन्हा मैडम को धन्यवाद देती हूँ जो सभी कार्यक्रम के लिए मार्गदर्शक है। आयुष मंत्रालय भारत सरकार के सचिव राजेश कटोटा जी का हमेशा अपने सभी प्रयासों में उनकी भागीदारी और प्रोत्साहन के लिए धन्यवाद व्यक्त करती हूँ। सभी गुरुओं का, शिष्यों का और विद्वान साथियों का हृदय से धन्यवाद प्रकट करना चाहती हूँ जिनकी उपस्थिति और सहयोग और सक्रियता से यह वेबिनार को सफल बनाने में महत्वपूर्ण भूमिका निभाई। आप सभी का धन्यवाद। थैंक यू वन एंड ऑल।
Thank you.